Washington Hospital Healthcare Foundation believes that Tri-City residents should have access to world-class and compassionate care in their own community, close to home. Contributions from generous donors and volunteers play a vital role in funding healthcare programs that benefit all of our patients, neighbors, and friends. As part of the district's mission to continue providing world-class care for its residents, Washington Hospital Healthcare System is currently building the Morris Hyman Critical Care Pavilion. This building will house a new emergency department with trauma rooms that will allow physicians and nurses to treat victims of collisions, industrial accidents, and other life-threatening events. With these trauma rooms, Washington Hospital will be able to apply to the county for Trauma Center designation.
Trauma is a severe injury that can be sustained in a variety of ways. It can be secondary to a car accident, it can be a fall off a roof, so it's any severe injury that causes significant injury to the body.
While funds from previous bond measures will help pay for the construction of the new building, none of these funds can be used for any of the furniture or equipment required to run the facility.
We have a pretty good handle and experience level with dealing with trauma now. What we're looking for in the future with opening our new emergency department is a step above that.
Trauma center requires resuscitation, and trauma requires different specialized equipment, which we don't have now. When these funds will be essential to procure that equipment.
What we really need are the funds to provide specialized equipment in the trauma room so that we can care for these patients in our community. As a designated trauma center, we're required to have all types of specialized equipment that aren't available in the emergency department on a daily basis. And so your contribution will allow us to provide the equipment that we need to take care of trauma patients in the right place at the right time.
Washington Hospital is proud to provide care to all of our residents in the emergency department, no matter what their financial standing may be. Trauma knows no bounds and affects everyone regardless of age, ethnicity, or financial background. It is the district's goal to ensure that all members of the community have access to high-quality health care, and that's why all the contributions to this year's Top Hat Fund-a-Need auction will go towards purchasing equipment for the trauma rooms in the ER. With your help, we can ensure that all residents in the district have a fully staffed and equipped trauma center to support them in moments of extreme crisis.
Having the trauma center in Fremont really is an imperative that we need to embrace. We can't have trauma occur locally and transport it another 30 minutes to hospitals that are outside our community. We need to have the resources to care for these patients and provide their long-term recovery here in the community.
On a personal, professional level, I think the most excitement comes from the ability to take care of people within our district that need our immediate help. Right now, unfortunately, without the trauma center designation, we really can't adequately take care of trauma patients, and they have to leave our district. But these are people when we get the trauma center designation, we'll be able to take care of here locally.
I am very excited about opening this new emergency department, adding the level 1 trauma to it. This really is a culmination of my entire 38 years of practice here at Washington Hospital. This has been a thought of ours. It's been in planning for a long time, and finally it's going to come to fruition, and I am really excited about it.
And now, please welcome Dr. David Orenberg and Brenda Brennan.